Good morning, this is a week 3 video presentation and the subject is association between deodorants and or antiperspirants and breast cancer. Background and objective. Over the past 10 years, the potential association between underarm deodorants and or antiperspirants utilization and breast cancer risk has raised important interest in the scientific community. The objective of this analysis is to estimate the pool risk of deodorants and or antiperspirants used for breast cancer. In a study performed by Darby, it was found traces of parabens in breast tumors. Parabens are preservatives used in cosmetics, foods, and pharmaceutical products. Although there is no proof that parabens cause cancer, and most deodorants no longer contain these compounds, the authors reported that the detection of parabens in human breast tumors is a big concern since they have been shown to mimic the action of the female hormone estrogen, which can drive the growth of human breast tumors. Hypothesis. We're trying to determine if the hypothesis stating that there is an association between breast cancer and deodorants is true. A few studies with the same hypothesis revealed that the suspicion of the link between those two is not strong at all. For instance, in the McGrath study, the authors surveyed the underarm hygiene habits of 437 women with breast cancer. Women who shaved their underarms more than twice a week and applied deodorant more than once a week were almost 15 years younger when they were diagnosed with breast cancer than those who never had those habits. The study found no link with breast cancer diagnosis in younger age when either shaving or deodorant was used alone. Another study researched why carcinoma of the breast is commonly found in the upper outer quadrant. The examined hypothesis of this study was that underarm cosmetics caused breast cancer. The result of the study rejected this hypothesis and showed clearly that the high proportion of upper outer quadrant carcinomas of the breast is rather a reflection of the greater amount of breast tissue in this specific part of the breast. Population. In the peer-reviewed article chosen, which is Breast Cancer and Deodorants/Antiperspirants, a systematic review, performed by Allen in 2006, two studies were in question. The first study was conducted in the US and investigated the possible relationship between the use of products applied for underarm perspiration and the risk for breast cancer in women aged 20 to 74 years. The second study was conducted in Iraq and investigated the possible relationship between the use of antiperspirants and the risk for breast cancer in women attending a teaching hospital. Type of study. Two case-controlled studies were chosen in this peer-reviewed article, and both were performed between 2002 and 2006. Sample size. I already mentioned that the first study was conducted in the US. This population-based case-controlled study gathered information by in-person interview, and it consisted of 683 people. The second study was conducted in Iraq, and there was a number of 53 people included for this study. Big difference between the first and the second one. Recruiting strategies and inclusion criteria. As I mentioned before, the in-person interviews were used as the recruiting technique for both studies. In the US study, the authors asked whether the participants frequently shaved under their arms, implying that deodorants and/or antiperspirants might contain harmful substances that could be absorbed via small nicks or abrasions caused by hair shaving. Also, as I mentioned before, the second study was performed in Iraq and included 53 people. In this study, the cases were women attending the oncology clinic that were diagnosed histopathologically by excisional biopsy. Meanwhile, controls were attending the general medicine clinic for various other complaints, not including breast problems. In terms of demographic variables between the two studies, there was a significant difference between both. Although both studies included only women, age was restricted in the Merck study, or the US study, to 20 to 74 years old, while age was not specified in the Iraq study. Also, the number of people on both studies show a great difference as well. 683 people for the US study compared to 53 people for the Iraq study. Finally, the customs and traditions of both countries, Iraq and the United States, can be considered too apart from each other. Here is part of the slides. Here is a slide for demographic variables. And here's some information that I'm going to talk about next. Now, findings in the US study and the Iraq study. The odds ratios for those women who use antiperspirants exclusively, ever regularly, and regularly within 1 hour of shaving were 0.8, 0.9, and 0.9 respectively. Meanwhile, the odds ratios for those women who use deodorants exclusively, ever regularly, and regularly within 1 hour of shaving were 1.1, 1.2, and 1.2 respectively. In the Iraq study, the authors only asked about antiperspirants. The unadjusted odds ratios for those women who use antiperspirants was 0.4. Now the combined or the pool odds ratios for the risk of the antiperspirants applying the fixed effect model was 0.40. That's the final result for both studies. This is the second slide that I was talking about and the final results. Then article conclusion. In conclusion, the article's review did not reveal any possible association between deodorants, antiperspirants use, and breast cancer risk, and calls for conducting new studies about this controversial association. Also states that future studies should be performed on large prospective cohorts to increase their internal validity. I agree with this conclusion, especially about the sample sizes, which were not only too apart, but also in countries where the traditions and customs are significantly different. Also, for instance, in the Iraq study, they should have focused more on a bigger part of the population and not only on cases attending the teaching hospital. Since many of the participants considered the use of deodorant not relevant, recall bias was identified for the main limitation. As the article emphasized, recall bias could alter the results, especially since patients may consider deodorant use not important. Recall bias represents a major threat to the internal validity of studies using self-reported data. As our book states, a related issue that is somewhat different from limitations in recall is that persons being interviewed may simply not have the information being requested. Also, even though there was participation, which was limited by the way, the information provided might not be considered reliable because of how small the sample was in the Iraq study. As our book also states, zero participation could introduce biases that can alter the study findings. I believe that the type of study is the right one, but the sample chosen could have been bigger and applied to different geographic locations in the world. Here the slide about my conclusions and limitations that I just talked about. And that'll be all for my presentation. That's my information right here. And also the references for this assignment. Thank you.